Wraparound is the term used to describe a team-based, intensive coordination strategy to create a comprehensive plan to support learners who are at high risk of being removed from their educational and home settings. It can be implemented as a part of a positive behavior support plan for students receiving Tier 3 interventions who remain at high risk. Tier 3 interventions within a PBS structure should be initiated and evaluated prior to referring a learner for wraparound teams. This includes addressing both problem behaviors and skill deficits. For problem behaviors, a function-based assessment should be conducted for all prioritized problem behaviors. A behavior intervention plan should be linked to the hypothesis about the function of the behaviors. Progress monitoring and coaching should be established. The learner's repertoire must be assessed to identify any deficits that are impacting the learner's success academically and socially. Skills acquisition plans should be implemented to support the learner's development of new, important skills necessary for academic and learning success. The Center for Innovative Practices and the Child and Adolescent Behavioral Health Center of Excellence have created Wraparound Ohio, which provides a number of useful resources for planning and implementing wraparound supports. The National Wraparound Implementation Center and the National Wraparound Initiative, in conjunction with University of Washington, have also created and made available a number of highly valuable resources on wraparound procedures. In this training, I will reference some of these resources, but I highly recommend you explore their sites independently as well. The National Wraparound Implementation Center lists the 10 principles of wraparound supports as family voice and choice, community-based, collaboration, natural supports, outcome-based, team-based, individualized, strength-based, culturally competent, and unconditional care. Team members of a wraparound team may include family members, mental health providers, child welfare workers, professionals from the juvenile justice system, educators, and other relevant service providers. The wraparound team manager should emphasize buy-in from all team members with a common goal of providing consistent support to learners to help them remain safely in their schools and homes. In a wraparound team, a team manager or facilitator oversees a coordinated strategy to identify priorities, develop an action plan, and to monitor learner progress. They build alliances between family members, educators, and professionals from a range of behavioral and health fields to consistently implement care and support plans. They facilitate communication, provide feedback, and actively assess for any needs to modify services or support plans. Behavior analysts who coordinate positive behavior supports within a school may serve as a wraparound team manager or be one of the team, working as a professional service provider, creating individualized Tier 3 supports. Wraparound supports incorporate both natural supports and professional supports, prioritizing the perspectives and preferences of the learners and their families. In the context of wraparound supports, when we talk about natural supports, typically this is referring to supports from family members, child care providers, coaches, friends, mentors, or other supports from non-professionals in the learner's community. Wraparound teams will often arrange services including training and respite services for the individuals providing natural supports. In some cases, wraparound teams work to help families access extended services, including transportation, housing support, and recreation opportunities. Wraparound Ohio provides a good template to use to help you identify participants for a wraparound team and to document the process. You can utilize the template, modify it, or create your own. Wraparound team supports can require a lot of resources. It is not feasible to implement such high resource plans for all students at high risk. But for those with the most complex combination of risk factors, it is a strategy that can be effective. According to the research of Bruns et al. In 2014, learners with serious emotional or behavioral disorders, SEBD, or emotional behavioral disabilities, EBD, who have multiple mental health diagnoses, academic challenges, family stressors, and other risk factors are candidates for wraparound teams. The National Wraparound Implementation Center explains that the wraparound approach is designed to support learners who are at risk of being placed in juvenile detention, hospitalization, or residential care, who have complex trauma, co-occurring disorders, and or significant developmental delays, as well as those with frequent crisis and emergency medical needs. Students who are eligible to receive wraparound team support nearly always are already receiving services from several disconnected systems or professions and often experience service disruptions. The 2014 research of Bruns et al. Suggests that wraparound teams use the Managing and Adapting Practice, MAP, approach to planning and coordinating supports. In step 1 of MAP, evidence-based interventions, supports, and approaches are identified, and the practices and procedures that are determined to be commonly effective are selected for implementation. In step 2, outlines or flowcharts for organizing care and support delivery are developed to create the wraparound processes that will be followed. The final step, the measurement and feedback step, involves the collection, evaluation, summarization, and sharing of data on progress and practice delivery that can be used to support ongoing decision making. Planning a wraparound approach will include a careful review of the student's records and all of the services a learner is currently or has previously received. Once a learner has been identified as a potential candidate for a wraparound team approach, the process is typically initiated by obtaining a social history of the learner. This is followed by identification of all relevant, willing, and appropriate team members. The team will then identify the learner's strengths and needs together, as well as the strengths and needs of the supporting family members. Interventions should then be designed to build on the current strengths of the learner and meet their identified and prioritized needs. Regular, consistent check-in points should be scheduled for monitoring of progress and collective decision-making regarding modifications or revisions of the supports and plans. In a wraparound team, there should be engagement from all members in the problem-solving process. Every step of wraparound team supports should be documented. While there are a lot of different options available to use for documenting various steps, I highly recommend reviewing the documentation templates from Wraparound Ohio. Especially early in your career, being familiar with these resources can be very helpful. As a behavior analyst, there are a number of things to consider regarding your own participation in wraparound supports, specifically within the context of a positive behavior support program in a behavior analysis and education practice. There are a wide range of ethical, practical considerations that need to be evaluated for participation in wraparound services, whether you are leading the team or providing services as a member of the team. Since it is a highly collaborative approach that involves professionals from a range of fields, as well as family members and other support individuals, it is important to consider how the responsibilities of consent, confidentiality, communication, and documentation will be handled. There are also questions about the utilization of assessments and interventions from other scopes of practice and how to appropriately participate in a collaborative, multidisciplinary team while staying within your defined role and scope of competence professionally. In wraparound teams, it is important that issues of culture and diversity be addressed appropriately. Behavior analysts might also need to consider how they will be responsive to situations where members of the team advocate for implementation of services or interventions that they do not believe are in the best interest of the learner or that may put the learner at risk of harm. To make informed ethical decisions, behavior analysts will often conduct risk-benefit assessments. It is their obligation to document their decision-making process and any steps they may take to resolve issues or concerns. When deciding whether or not to refer a learner for wraparound approach, a behavior analyst may engage in a risk-benefit assessment as well. As with all ABA procedures, it is important to embed a plan for assessing the success of the procedure within the overall plan. For wraparound team supports, it is important to measure the fidelity of planning and implementation, as well as the outcome for the learner. In the Wraparound Implementation Guide by the National Wraparound Initiative, a partnership of Portland State University, there is a self-assessment of strengths and needs that can be used as an assessment tool for the planning and implementation of wraparound supports.